Just a little bit about me, a background about me. I'm part Southern Italian, part German, and part Irish. And they're all very hard-headed and stubborn. And my family doesn't like physicians, and I'm the first physician in my family. So I've had the life goal of convincing my family to be healthier. And they're pretty darn healthy. They do like to stay away from doctors. So my goal has been to help people to give people basically the ability to take their health into their own hands, avoid doctors, and I'm a radiation oncologist, so it's a losing financial proposition for me, but that's fine. And once people do see me, to make sure that I don't have to see them too often in the future. So that's a little bit of my background. This talk was originally fortifying the treatment of prostate cancer with diet. I've switched it to lifestyle because it's hard to separate the two, and I'll explain why momentarily. Couple quick goals. First and foremost, to review the interaction of diet and activity with cancer outcomes. When I first gave this talk, most of the talk was that, convincing people that diet and exercise matters. Nowadays, we agree with that a lot more, but it used to be a big uphill battle. Secondly, to review existing data supporting nutritional intervention in prostate cancer care. Third, to discuss tangible lifestyle changes that may improve the chances of cure. Again, going on what you said, it's one thing to know you should do something, but how to actually make it happen is a whole different story. And the last is to explore future directions of lifestyle in the treatment or in the management of prostate cancer. So this all started for me about 4 or 5 years ago. This is when I first gave this talk. When I was in residency, I noticed that one of the most common questions asked by patients, any patient really, was, well, there's three main questions. Can I have sex was the first one. Can I drink wine was the second one. And what should I eat during treatment? And as being the most common question asked by patients, it was pretty pathetic as a physician that we couldn't even give them the answer. So we did a study asking patients where they were going for this information since they weren't getting it from their physicians. And lo and behold, most of them said they were going online. I'm sure most of us in the room do the same thing. So we went to the sources online that these patients were going to. And these were the NCCN cancer institutes, so the creme de la creme of the cancer institutes in the country. And we looked at, there's 22 of them. We excluded St. Jude's, the pediatric hospital, and looked at how many were actually telling us or telling patients what they should be eating during or after treatment. Only 4 of the 22 even made recommendations. And then they also talked about additional websites. And so up here you have 8 of these institutions. I did have the names listed when I initially submitted this paper for publication, and at the time I was interviewing for jobs. I made several inflammatory comments about these places, and I was applying there, so I've since put numbers instead. So as you can see here, this is carbohydrates, protein, or fat, and we went through all these the types of food, the low fat, high calorie, low calorie, and this is what we got. As you can see, it's all over the map. The 2 on the left there, 10 and 11, and I have a job now, so I can tell you, that was actually Harvard and Brigham up in the Boston area. And you could see there, it's pretty much a nearly all carbohydrate diet. So very low fat, very low protein as well. That's kind of the traditional cardiac prudent diet. And that's even up to question lately due to newer data. And then on the far right is when you go out to the West Coast, and they push a much higher fat diet, very much higher protein diet, and a lower carbohydrate diet. And that's kind of a like eat whatever you can, just don't lose weight type of diet. But regardless, looking at this, depending on what time of day you go on the internet or what website you go to, you're going to get totally different opinions from these. So that was very concerning that the most common question asked is answered differently by our major institutions throughout the country. So I submitted this. I thought it was intriguing, submitted to a big journal, and these were the responses that I got. First is, we don't have any data showing effect of diet on cancer treatment or outcomes. Diet is unlikely to play any part in cancer care. Therefore, this article is irrelevant for this journal. So just, yeah. And it was the fastest rejection I think I've ever gotten. And so the first one I think is what most physicians and patients think. And so I wasn't that upset about that one. The second one is, with my family background, that was just offensive. But that's okay. It eventually got published in a decent journal. And when it got published, I considered it somewhat of a failure. Then the ASCO, this is the American Society of Clinical Oncology, called about the article They thought it was very intriguing, and they put it in their monthly newsletter. The National Cancer Institute, the NIH, called, same thing. They put a big article on it as well. Medscape, again, did another one. And then the major medical news source in the country, the Sanjay Gupta Guide, actually called, which was really neat to say that, but they put an article on this as well. And at this point, it started to really set in just the different viewpoint that patients and physicians were having regarding this. Patients wanted answers, the media wanted answers, and yet physicians, you see those responses, they think that diet and nutrition doesn't even play a part. So in response to that first reviewer, I'd like them to look at this. This is a study from 1909. This is Dr. Mareshi, and he was experimenting with mice, and he was giving the mice cancer called a sarcoma, and then feeding them different amounts of food afterwards. And there's 4 groups of mice, as you can see on here. And basically, he fed them lesser amounts of food per group. And then if you see on the far right there, it says tumor weight, and you see 1.3, 3.6, 5.2, 7.6. Basically, he found the more he fed the mice, and the bottom there is ad libitum, that means you can eat as much as you want, the faster their tumor grew and the larger their tumor grew. Less the mouse ate, the opposite. The mice that had the smallest intake, that group 1, their tumor was about 1/7 the size of the other group. This is the first study, 1909. So for that first reviewer, that's the same year Geronimo, the Apache chief, died. And who was this? The French, she was Joan of Arc, thank you. She was beatified by the Catholic Church. So I think we do have a lot of data, because that's over 100 years old. Following this, Peyton Roos, who showed that a virus can cause cancer, was a Nobel Prize winner. He showed that you could grow the tumor first and then restrict the diet. And this was more like if a patient came into my office with a diagnosis, what could we do then? And this is a question he started answering, and I'm going to come back to that. And he again showed a slower growth in diet-restricted mice. So the mice that ate less, their tumors grew slower. The next big player in this is Albert Tannenbaum. And in 1947, he doesn't have a picture online. This is the mobster, Albert Tannenbaum. But he's filling in nicely here. He showed that you could get a 2 to 44 times lower spontaneous tumor growth in dietary restricted mice. So this is the opposite end of the spectrum. This is for preventative measures. He was doing the same dietary changes and showing that cancer happened less often. The point is, whether it's prevention or whether cancer was already diagnosed, clearly dietary intervention plays a role here in slowing tumor growth or formation. And then going 50 years later, there's dozens, if not hundreds of studies. This is one I really like. Dr. Stephen Hursting showed that you could just do a fast 1 day a week. The calorie restriction in mice eat a lot more than us. So to have the same as a calorie restrictive diet in humans, you actually have to fast for quite a long period of time. He showed if you did it 1 day a week, it decreased tumor occurrence, tumor growth, and it also decreased this thing called IGF. Okay, so he's starting to show people we can actually measure changes based on diet. As physicians, we like to be able to quantitatively measure changes. So this was one of the first studies to do that. And to look at it again, these are in nearly 50-year intervals. There's major studies here, and in between them, again, there's dozens upon dozens of studies. So I'd like to argue that we do have quite a bit of data. Interestingly enough, when you look at Tannenbaum's work, and this guy was very meticulous, he would measure the mouse chow, and he would change up the amounts of carbohydrates, the amounts of fat, and the amounts of proteins. He actually started to find that the biggest reduction in tumor growth, and if this is done with pencil, that's how old this is, was when he calorie restricted the mice, but he reduced the carbohydrates. And this often isn't talked about, but if you look back at his data, he starts to talk about this. The biggest changes, and you see on there with the C's, that's when he restricted carbohydrates to these mice. Again, the biggest difference in tumor growth. It's hard to see here, but the hatched line is how many tumors grew basically with the dietary restriction. So he's the first person to start showing maybe it's not just calories, it's about what we're restricting. And several others followed. This is from Dr. Herbert Grace Crabtree, and he made observations on carbohydrate metabolism of tumors, finding that cancer cells love to thrive on sugar. And this man below here is Dr. Warburg. He got a Nobel Prize showing the same thing, that whether oxygen was present or not, cancer cells don't care. They ferment it. They ferment the glucose. And fermentation is this thing that happens in our muscles, glycolysis rather, to break down of sugar. When you run real hard from something, you get that burning That's lactic acid. It's not an efficient way to make energy, and cancer cells do it regardless. So cancer cells love sugar. They love to break sugar down. Crabtree's an important player too. He also showed that yeast can be fermented into alcohol, and because of him, winemakers are now making better wine. So important player in many ways. Crabtree and Kramer banded together, and they also showed that cancer cells, when you restrict sugar to them, radiation kills them a lot easier. So I'm a radiation oncologist. This is more important to me here. This is 1933. And Crabtree also started to do tests where he gave an agent that blocked sugar uptake in cancer cells. And he started to show that it caused the cancer cells to die a lot quicker. Unfortunately, after this, the whole genetic aspects of cancer kind of took over, and we stopped looking at the metabolic aspects of it, but it's starting to pick up some speed nowadays. And this is 2013, so 2 years ago. This is data from Duke, Dr. Friedland and his group. And this is, if you look at these curves, basically the steeper it is, the quicker these tumors are growing. And these are prostate cancer tumors that are in mice. And on the left here is a Western diet. And in terms of all these dietary studies, Western diet's pretty much the worst thing you could do to a mouse. And he shows that mice on a Western diet without any hormonal augmentation, their tumors grow like gangbusters there. As you move to the right, he adds hormonal treatment, which is one of the standard treatments for prostate cancer. Then he switches to a no carbohydrate ketogenic diet. He switches to a 10% carbohydrate diet and a 20% carbohydrate diet, and starts to show that these tumors grow slower. So he's basically showing the same data that Tannenbaum and some of these other guys showed 50 years ago. If you restrict these mice, and particularly restrict the amount of carbohydrates they have, the tumors grow a lot slower. This is another study that he did, showing the same thing on the left here. You see the yellow, that's a Western diet. You see the blue, that's a low-fat diet. And in this study, it shows low-fat diet may be better than a Western diet, which I think many people agree on. But on the top there, I'm sorry, reverse that. That's how quickly it grows, excuse me, is the green. That's a Western diet. You put them on a low-fat diet, it starts to grow slower. You put them on this is a no-carbohydrate diet, and they start to grow even slower. So once again, confirming what these other guys showed us, but when you go to the right there, you start to see that the mice on that no carbohydrate diet actually start living significantly longer. Now this is in mice, and mice are different than us, but it gives us some other ideas as well. He started measuring some of these factors like Dr. Hursting measured. Insulin. Insulin's a hormone that our pancreas releases when we have high amounts of blood sugar. We like to have a very fine line of blood sugar. If it gets too low, we break down some things to bring it back up. If it gets too high, that could be fatal as well. We secrete this hormone insulin, which shuttles the sugar from our blood and into our cells. Because cancer cells like glucose, that's a good thing. When you get insulin out, it can shuttle into cancer cells as well. Insulin can also bind to receptors on cancer cells and cause them to grow. So it's doubly bad because of that. And on the left here is a low-fat diet, which again lowers insulin somewhat. Middle is a Western diet, which is the worst. And then the right is this low-carbohydrate diet. And the low-fat and low-carbohydrate diet in that regard are both pretty good. It lowers insulin, so it's going to feed tumors less. On the right, and this is a very important factor for prostate cancer, IGF-BP3 actually binds another component of insulin, so you want that to be high. And that's where this low-carbohydrate diet on the far right there starts to shine. That's the highest amount. It's even high in the Western diet. And it's very low in the low-fat diet. So it not only lowers circulating blood sugar levels, but it also lowers hormones that are secreted that may bind to cancer cells. And this is why. This circle here, imagine this being a cancer cell. This is the most sciencey I'll get after this. It gets a little better. I know everyone just had lunch and you're probably 5 minutes away from the post-meal snooze. But the receptor there is the IGF receptor, and insulin can bind to that. IGF-1 combined to that. Again, these are hormones that are secreted to lower the blood sugar amount. All those pathways in between lead to one thing, and that's cell survival, so cancer cell survival, cancer cell growth, and inflammation. Inflammation is like the fertilizer for cancer cells. Cancer cells love inflammation. It's bad for our normal cells. It's good for them. And then on the right here, we're going to come back to this at a later time. This is like the opposite. So the left is feast. When it's feast, things are growing, insulin secreted, IGF-1's around, cancer cells can grow. On the right there is famine. Basically, think about 30,000 years ago, you're out in the desert, you don't have a lot of food, your cells at that time see, there's not a lot of things around. We can't grow. We can't let cancer cells grow. We need to break things down. There's actually a process called autophagy where we recycle our spare parts. And then that activates these other factors that block this thing called mTOR. And there's actually medications right now, cost thousands of dollars, trying to block that. And this is why we see studies like this. Preoperative glycemic control status. So basically your blood sugar levels before surgery for prostate cancer predicts your risk of that prostate cancer coming back. And this is why you see this kind of data. So these are correlative studies, but interesting nonetheless. Why? This is a pictograph I like. It's very simple, but excess carbohydrates and sugar cause excess insulin, which causes an anabolic, a growth process. That's why bodybuilders carb up after a workout, but it also causes obesity, again, inflammation, diabetes, and can cause cancer. So the next question is, that's great. Animal studies are enticing. Are there any human studies that show that we can offset these pathways through diet? And in cancer patients, there really aren't, because this is a new frontier. We're trying to get these studies going. They're very expensive and very difficult to run. But there are studies in non-cancer patients where they're trying to lower heart attack risk, obesity, diabetes. And this comes from a review paper from a friend of mine. And this is more to make a point. These are patients, the dark lines there, they're put on a very low carbohydrate ketogenic diet, and this is not what I'm promoting. It's like an Atkins-esque type diet. And that was versus a low-fat diet. And the key here, the low carbohydrate diet, they told people they could eat whatever they wanted to. And this may be the different factor here that makes such an impact. In the low-fat diet, they calorically restricted them. So traditionally, we've told people low-fat, calorie-restricted diet, which is not very palatable, has been the way to offset these kind of things. And what this study showed was the opposite. So if you see the glucose there, that's sugar. It dropped by about 15% in people on the low-carbohydrate diet. And insulin, insulin, this hormone that can bind to cancer cells and upregulate their growth, slowed down by 50%. It decreased by 50%. So this was a pretty profound change. And interestingly enough, this group did decrease the amount of food they ate. So they ate less than the other group. The one group was constricted. They were told they could eat as much as they wanted to, and they ate less. So it's unclear if that's what caused these changes. And again, I'm not saying to go on that extreme of a diet, but the point is it's quite significant. And I was actually giving this talk to my grandma. She's 93. And she said, that's nothing new to her. She knew that if you cut out potatoes or some of those things, you can lose weight. And actually, Leo Tolstoy knew that as well. In Anna Karenina in the 1870s, he talks about Vronsky, who was always running, trying to cut weight. He says he had no need to be in strict training, as he had very quickly been brought down to the required weight of 160 pounds, but still he had to avoid gaining weight, and he avoided starchy foods and desserts. So this is not new. Nowadays, we are figuring out the pathways of why this happens. And this brings up a lot of controversy. You saw my first slide of all those expert cancer centers and the different recommendations you see. You all in the room, as myself, have probably talked to people who've told you drastically different things about what foods to eat. On the top left here, I think most people are in agreement that green leafy vegetables, tomatoes, bright colored fruits, berries especially. Of the fruits, berries are the best: raspberries, blueberries, strawberries. Avocados, these are foods with healthy fats. These are foods that have been alive, so nothing out of a box, nothing out of a plastic package. On the right there, less cupcakes, sugary things, baked goods. Even bread is starting to turn less controversial. And then in the middle there, I have my eggs, meat, and fish. I think most people agree omega-3 heavy fish like salmon and cod is pretty healthy. Eggs have gone through the ringer. I feel bad for eggs because they are actually quite healthy. And the yolks people are agreeing now. I saw there's a pamphlet out there on the table that talks about this, including the yolks. They're very nutrient dense. And again, going back to the whole caveman, you have to think about what were we trying to eat when our food was sparse, and we eat the most nutrient dense foods. We want to get the biggest bang for our buck. And there are studies, going back to that other study, there are other studies showing that when you eat a nutrient dense diet, you actually end up eating less food overall. So if we're trying to really get people to cut calories, let them get the biggest bang for their buck. And then controversial on the bottom there is whole wheat grain type. I think in moderation they are fine. I like one thing, I call it the bread basket test. If you can eat one piece of bread in a bread basket and be okay, then you're good. You're very skilled. If you eat one piece of bread in a bread basket and then eat the entire rest of the basket, which is what I generally do, I don't eat bread anymore because I know what's going to happen. So what does this have to do with prostate cancer nowadays? This is a study from the radiation therapy oncology group. And these are patients that were given radiation and immediate androgen deprivation therapy, or radiation and then delayed androgen deprivation therapy if their PSA was found to have risen. And lo and behold, the immediate androgen deprivation therapy showed a survival benefit, and that is why it is now part of the standard treatment for high-risk patients. But when the group went back and looked through the data, this is prostate cancer-specific mortality. So the higher on this curve you are, the higher risk you have dying from the prostate cancer. And the good news is it's low overall there, out at 9 years. But they found that people with a body mass index of less than 25, so more normal weight males, lived significantly longer without dying from their prostate cancer. Those that had more weight died significantly more often. And this is really the first study, to my knowledge, to look at this and start to say, uh-oh, there's some other factors here besides just the radiation and besides just the hormones. And why is that? So this is mostly because of visceral or central adipose tissue which happens in men. That kind of beer belly, the tire. If you look down below there, causes what's called insulin resistance. So that's when you have, again, I'm going to harp on this, high levels of blood sugar, high levels of insulin trying to pull that back in, and high levels of that hormone IGF-1. So if you eat a poor diet, it can cause those changes acutely. If you have kind of the beer belly, it can leave you in a constant state with those changes, the higher insulin, the higher blood glucose, those kind of things. So that's why we want to keep this down. Looking straight up on there, it also causes hormone changes, and we all know how intimately prostate cancer is related to hormonal changes. So this adipose tissue actually secretes hormones. And then looking at left and right on there, those are just more inflammatory components. So fat tissue actually secretes inflammatory components. Again, these are like fertilizer for cancer cells. So we want to do whatever we can to keep that down. And mostly that's related to diet. And exercise is very good. Exercise is a poor surrogate for weight loss, but exercise does do things like lower the inflammation aspect of that, raises insulin resistance. And again, this initially was a straight diet talk, but because of these factors, I felt like I really had to talk about exercise. So my first question is, what is exercise? And a lot of my patients, when I talk about exercise, this is what they have in mind. You know, the guy, those are Zubas. Do you guys remember the Zubas, weightlifting pants from the 80s? Throwing around a ton of weight on the bench press. And that's a type of exercise, but that's not exercise. And I want to convince you that any kind of activity is actually exercise. And this is a study of 2,000 men that were followed for 20 years with prostate cancer. And they found that men who are active live significantly longer. So not wearing your Zubas and bench pressing, just being active makes you live significantly longer. Men who walked 90 or more minutes per week at a brisk pace had a risk of dying halved when compared to those men who did not walk or did so at a very slow pace. So 50% reduction in death is, if we could prescribe a drug that could do that, every insurance company in the world would pay for that, and they'd pay quite a high price. 3+ hours of vigorous activity, you had a 61% lower risk of dying from prostate cancer. So that's, again, these are big numbers. And these are correlative studies, but interesting nonetheless. And men who exercised vigorously before and after their diagnosis of prostate cancer had the lowest risk of dying from their prostate cancer. Other data shows that it may be more related to briskness. These were looking at men who walked less or more than 3 hours per week and less or more than 3 miles per hour per week. And on the right there, if you walked less than 3 hours per week, but greater than 3 miles per hour, again, you have a 40% risk of, or 40% decreased risk of dying there from your prostate cancer. If you walked 3 hours or more per week, 3 miles per hour or more, it drops down to, that's 43%. So again, these are very profound. And that's not bench pressing at the gym, that's walking fast for 3 hours per week. And that's something we can all do. We can all do that during our lunch break. So why does this happen? I'm bringing you back to the sciencey slide here. On the far right there, again, that the left is the feast, the right is the famine, and this kind of goes back to the evolutionary caveman-esque aspects of our metabolism. When you exercise, this thing called AMP kinase gets upregulated. When you don't eat anything, so overnight when you fast, this gets upregulated. Again, it's these kind of survival mechanisms that get upregulated, and it stops the proliferation of cells. And this makes sense, right? If your cells are sensing there's not a lot of energy present to use, not a lot of resources present to use, they're going to down-regulate the growth of these cells. So this is one of the pathways. And then the nice thing about this as well, it also increases insulin sensitivity, which means your body secretes less insulin per a certain amount of glucose coming out. So very insulin-sensitive people, even if they eat a Cinnabon, they're not going to secrete that much insulin. Whereas people that are not very insulin-sensitive are always secreting insulin, and this can end up leading to type 2 diabetes. This is another study with 4,263 men, and this is more intriguing. Now we start to sparse out what makes the difference. Greater than 5 recreational MET hours per day, so that just means more metabolically active exercise. Walking or bicycling for 20 minutes a day or more lowered your risk of dying from prostate cancer by 30%. Performing household work, this is my favorite. An hour or more per day lowers your risk of dying from prostate cancer by 30%, and everyone's happy. Exercising just an hour a week lowered these men's risk of dying from prostate cancer by about a fourth. And the point here is that any activity is good activity. You don't have to exactly exercise for 1 hour a week, but these are all surrogates for being active. And again, performing household work for 1 or more hours per day decreases your risk of dying by 30%. So keep that in mind. This always makes me think about, you guys know that Mr. Mom, Michael Keaton, he's from Pittsburgh, and he didn't realize it, but when he was buying his wife maxi pads, he was helping his health out. And this is Michael Keaton with a Chicago native, Norm, from Gung Ho. And St. Malachy's is actually my grade school that I went to. And Michael Keaton made him wear the t-shirt for the movie. And I actually bring this up at every time I give a talk, and it's not any better today with this man from Chicago, which I actually didn't even realize. I Googled him last night to read about him, so interesting. Last but not least, I'll start rounding off here. Hippocrates, who's a couple thousand years ahead of everyone else in terms of being a physician, had this quote: "It is more important to know what sort of person has a disease than to know what sort of disease a person has." So going back to the type of exercise, and this is data from Harvard, and these are the amount of calories burned in 30 minutes. And calories aren't the end all here, but it gives us kind of a perspective. So sleeping obviously is the slowest, it's 28 calories. Watching TV is not much different than being asleep. When you start reading, your brain uses a lot of glucose, so the amount of calories starts to pick up. What was really interesting to me is if we get to the bottom there, weightlifting is 266,000 calories burned in 30 minutes, which is not that different from washing a car. Washing a car is 200. So maybe something as simple as not taking your car to the car wash and washing it yourself can be the equivalent of going to the gym and working out. Not everyone wants to go to the gym and work out. Walking 4 miles per hour, which again is not that hard either, 200 calories in 30 minutes. Cooking, again, helping around the house. Gardening, even gardening has high caloric amounts. So these are things to keep in mind. You don't have to go to the gym and throw some weights around. You could do these other things. We do want you to pick up your heart rate every once in a while and do something intense, and frankly, that's washing a car. And this is, I like to look at these scenarios if we just switch out a couple things. And this is the first scenario. I call it the common American night. You watch TV for 3 hours. You burn 33 calories per hour. You go to bed later because you're staying up watching the show. You rise the next morning and you hurry to work. And you burn a total of 99 calories. And I do this. Everyone does this. So in the scenario 2 is the hour switch. So watch TV for 1 hour while cooking instead of just sitting there. You burn 111 calories per hour then. Read for an hour. You burn 50 calories per hour. You learn something. Go to bed an hour early. Wake up an hour early. Garden in the morning, which you burn an extra 200 calories per hour. And then you end up burning 361 calories instead of 99. And I've done this multiple times and actually feel better throughout the day. And that's the added benefits. So it's not just 4 times as many calories burned, You feel more rewarded. You have a garden that you can take care of. You then provide yourself with reward, stress relief, and organic vegetables. You get sun exposure in the morning, so it provides vitamin D, which is good for your bones. It's good for your prostate. It helps relieve stress, and it helps your circadian rhythm. The sunlight in the morning cuts off a part of your brain that makes melatonin, which can make you sleepy, so this makes you more alert for the rest of your day. You're more productive at work, and you're not waking up and rushing. Very simple changes. Again, exercise doesn't have to be wearing Zubas and bench pressing at the gym. And this is a study over 8 weeks in 21 men receiving radiation for prostate cancer. Half of these men went to aerobic exercise classes 3 days per week, and this was over an 8-week period. These men saw improvement in cardiovascular fitness, so their hearts worked better towards the end, flexibility, muscle strength, overall quality of life, and there was less fatigue. Fatigue is the #1 side effect of radiation. We literally have studies where we're giving patients like Ritalin-esque drugs and caffeine-esque stimulants to help fight their fatigue. Yet, if you just do some exercise 3 days a week during treatment, it can provide the same types of benefits, and it's free. Other studies reveal that exercise decreases risk of urinary incontinence after surgery, after prostatectomy. It decreases body composition changes during hormonal therapy, which hormonal therapy does cause quite a bit of metabolic changes throughout. So if you can fight these through exercise, it's a pretty positive thing. And last but not least, it decreases blood sugar and insulin levels, those two enemies that I've been talking about at length. And living longer is great, but living longer and feeling better is the key for everyone. We have a trial at my institution I'm running with breast cancer and prostate cancer patients where we actually put these Misfits on them and track their energy levels throughout treatment. So we're trying to, we know that radiation makes you more fatigued. We're trying to figure out how much it does so, and we're trying to then figure out ways to combat this. And I've been wearing one of these. It's interesting. It makes you move more, and you're constantly trying to get, there's a circle on it that spins around, and you're constantly trying to get it up. And you know, I just need these kind of things to make me move more. So something as simple as that might make you increase your exercise levels. The last benefit, and this is going on the heels of what Dr. McLean was talking about, this is a slide from a study for very aggressive lung cancer patients. And they followed these lung cancer patients after doing psychological testing on them. They found that lung cancer patients with a positive attitude live significantly longer and beat their cancer over a 10-year period. Now again, this is very aggressive lung cancer, but as you see at 2 years, at 5 years, and at 9 years when they followed these people outward, the positive patients live significantly longer. And I think this goes back to the control aspect. I think at times physicians are too paternalistic. We tell patients, you know, you're gonna take this, you're gonna do this radiation, you're gonna do the surgery, you're gonna take these pills, and then that's the only thing that's gonna make a difference. This is putting the patient back in the driver's seat and giving you the tools to change your outcome. And I think this is important for a lot of people. So I'm gonna wrap this up here, I have another minute. In summary, reducing weight, especially in the central area, increases overall and prostate cancer specific outcomes for men with prostate cancer. It's accomplished with a healthy diet and lifestyle. And along the diet, I know, I think at 3 o'clock, I have about 15 minutes to answer questions. So we can get into more specifics. I just wanted to get the science out there first. And then if you Google me, I have a website where I talk about these things. Active patients live longer and they feel better. It's healthy to help out around the house. Can't emphasize that enough. And maybe most importantly, lifestyle changes put the patient back into the driver's seat of their care. Thank you very much.
Thank you very much for a very informative lesson to us. I have a question. Do you have any study where you can say that one country is has less prostate cancer than another country because of the lifestyle, or maybe because of the diet, or whatever you think it's a cause? Thank you.
So not even just with prostate, with many different cancers, there's a lot of studies that show the country, the amounts of risks and those kind of things in different countries. The Mediterranean area, there's lower risk with the Mediterranean kind of diet and lifestyle. There's studies in Japan, being on some of the islands, have lower risk of cancer, live longer, and as soon as they move to the mainland and adopt a Western lifestyle, they go right back to it. So there is plenty of data, especially over the last 50 years or so, showing a different relationship. America's pretty bad, unfortunately, overall. Like the switch to the Western diet's usually a negative in that regard.
And somebody asked about what your website is.
Let's go ahead.
Can you just tell us what your website is? What page?
So it's Caveman Doctor. I know it's cheesy, but and the point is to take complicated scientific topics and then kind of whittle them down and then provide some tangible recommendations.
Okay, Bob, lay it on us.
What role, if any, does optimism play in your own autoimmunity and surviving cancer?
Yeah, a great question. So there are studies in other breast cancer and some other sites as well, going back to the talk before about mind, body, and those kind of things, where it does lower inflammatory markers like C-reactive protein and interleukins and these other things, where we know if they're high, prostate cancer patients can do worse. You know, these are associations, so we need more randomized studies to look at this. It's problem with randomized studies is they cost a lot of money and they need funding, and you know, there's not yoga groups funding these studies. But the data's compelling, and because of places like this and in this organization, these things are starting to happen. So,
Dr. Chodak, you had your hand up.
Yeah, first of all, that's an outstanding talk, and
Thank
I
you.
want to congratulate you on not overstating what we know and don't know. But now the question is, what can we leave as messages for the people in the audience? To begin with, how many people were told by their doctor to get in an exercise program? Show of hands. How many of you did it? Okay, so there's a good beginning. The information you're showing about the carbohydrate diet, so, you know, obviously you don't have the kind of studies that would prove benefits from there. What can you tell them they ought to be doing for the moment diet-wise? Are you strongly encouraging patients to greatly reduce their carbohydrate intake and modify their diet and get their weight down? Is that an easy take-home message for them?
I think lowering carbs in general is an easy take-home message. The hard part, and that's what I was getting on, is how to navigate that. So I think the easy targets are, when you do turn towards carbohydrates, green leafy vegetables, berries, brightly colored berries, fruits. Those kind of things are unanimously felt healthy in the medical world. The breads, the pasta, those kind of things, the foods that often lead to overeating, I think, are maybe more of the easier targets. And that's why if you can eat them in moderation, that's a whole different story. But if you can't, then that's an easy place to go. And the sugar, of course, is a very agreed upon food that we should limit.
One more.
Good question.
Over here, one more. Chuck?
Sure.
Yes, thank you. Your presentation just verified a diet study that I just completed in Memphis with the West Clinic. This was the diet department, and they had us just document for 90 days what we ate, our activity, not exercise, but our activity, the amount of sleep we got, the spirituality of church or reading. And for me personally, I don't know if the group did, but for 90 days, I documented my vegetable and fruit intake, my water intake, all of my liquid intakes. They didn't tell us what to eat, they just told us what categories we should be eating in. And after 90 days, I had lost about 5 pounds. My body mass index had dropped. My blood pressure was better, and you know, it was amazing. 90 days of just following and documenting what I was eating, and I feel that documenting what I'm eating is a lot better than just winging it. If I can follow what I put in my body every day, I'll have better results.
I think that's an excellent point for everyone. And that's why even the Misfit trial that we do, just knowing you're calculating something makes you want to do better at it. So,
Well, let's thank Colin for the great presentation.